All right, good morning, everybody, and welcome to the community briefing regarding the COVID-19 vaccination efforts taking place across Clark, Skamania, and Cowlitz County. I'm Stan Hinatsu, the Public Information Officer for the Pacific Northwest Incident Management Team 3. This morning, our format this morning will be to first provide a quick update on the statewide vaccination efforts, an update on the Clark County Fairground vaccination site, and then we'll follow that up with some frequently asked questions that we've collected over the course of the last 2 weeks, and we'll direct those to a couple of speakers. And then if we have time, we'll entertain questions that come through on Facebook. So before we move on, I want to introduce to you our speakers. First up, Lauren, if you could turn your camera on. Lauren Jenks, Assistant Secretary for Environmental Public Health with the Washington State Department of Health. And Dr. Krager, if you could turn your camera on. This is Dr. Stephen Krager. He's the Deputy Health Officer for Clark, Cowlitz, and Skamania counties. And then I'll introduce Randy Johnson, who will step in here and with us here. He is, go ahead, right here. And he is our incident commander for the Pacific Northwest Incident Management Team 3. Thank you. All right. Sorry, Randy, I'm pushing you back out.
No worries.
All right, so first up, we'll have Lauren Jenks provide a quick update on the statewide vaccination efforts and an update on the vaccination site. Lauren, we'll turn it over to you if you turn your camera on and mute off. Thank you.
Yes, good morning, and thank you so much for setting this up and inviting me to come share today. The statewide vaccination plans are going well. They are limited by the amount of vaccine that's coming into the state, and that is limited by the amount of vaccine that the manufacturers can make in a given amount of time. We do have more than 500,000 people in Washington state who have already gotten at least their first dose of vaccine, which is exciting. That's more than the number of people in the state who got COVID. So that's good. This is definitely moving in the right direction. As we moved into phase 1B tier 1, we now have 1.7 million people in Washington who are eligible to get the vaccine. And into the state every week, we're getting about 100,000 first doses of vaccine. So that means it's going to be many weeks before we're able to get to everybody in that eligibility group. But we will be moving on to the next tier of people who are eligible when we get about 50% of the people in our current tier vaccinated. So to do that, what we have been focused on is building the capacity in the state to give the vaccine. We want to be able to give a lot of vaccine very quickly in the case that the manufacturers are able to produce a lot more, which is certainly something that we are hoping and expecting. So for example, we're working with doctors in the community, with community health clinics, with pharmacies like Walgreens or CVS or something like that, and setting up these mass vaccination sites to make sure that as the vaccine comes in, we have a place to put it, and those people have a way to get to people who are eligible to get vaccinated. And then we ask those folks who are setting up, how many vaccines do you think you can give this week? And in this last week, all of our providers requested more than 300,000 doses of vaccine, which is great. So that means we had the capacity at a moment's notice to give out 300,000 vaccines this week, but only 100,000 came in. So the good news is we're gearing up so that we're going to be able to give a whole lot of vaccine as it comes into the state. And the bad news is we had to disappoint a whole lot of people this week who had the capacity to give vaccine, were able to do it and excited to do it. And we had to say, yikes, we only got about a third of what we would be able to deliver this week. So that that is the situation that we're in. We're excited about some of the news that's coming in from the national level that does seem to indicate we might be able to get more vaccine soon. So that's wonderful, and we'll be ready for that when that happens. One of the ways that we're gearing up to give a whole lot of vaccine is through these mass vaccination sites, like you do have one in Clark County, and those are going so well. We had hoped that they could give each one could give about 500 a day. In the first week, every one of them was able to do more than that. We had a little blip in Chelan Douglas when it snowed, and we went down a little bit, but for the most part, everybody else has been able to meet and exceed that goal, including in Clark County, where on Friday, they gave out 800 vaccines, which is wonderful. And as of Friday, I think they were all vaccinating on Saturday, but Friday is my latest numbers right now. We had given out more than 10,000 vaccines through those mass vaccination clinics just in that first week. So we're excited to see that that does seem to be an effective way to get vaccine out in the community. And as more and more vaccine gets manufactured and delivered to Washington State, we are ready to go with that. And I'll be happy to answer whatever questions people have about our vaccination plans.
All right, thanks, Lauren. We'll save some of those questions if we have time for the end. Next up, I'd like to have Randy Johnson come up, who will address why in the world is an IMT, incident management team here, and what is our role?
Thank you again, Stan. And thank you, Lauren, for that update. That's good information. I know a lot of folks are wanting to hear. So yeah, why is an incident management team here? What is an incident management team? So again, my name is Randy Johnson. I'm the incident commander for Pacific Northwest Incident Management Team 3. We are a group of individuals. We have 30 folks here on this assignment that come from quite a wide background. Local emergency service agencies, state agencies, federal agencies all come together on these teams to bring their skill sets and their expertise to assist communities in their time of need. One of the things that we spend a lot of time doing is in the wildland fire arena. So we obviously last summer were quite busy with that across the West, and ended our year on our last assignment in November in Colorado. So the group gets exercised quite a bit, and we were reached out to from the Tri-County area here, Skamania, Cowlitz, and Clark County through the Regional Health Office. The request went up through the state to FEMA to get some support for the efforts here locally. So what we bring to the equation is experience in large-scale disaster, as well as a lot of process and the ability to plan. We had some good conversation initially about, does it make sense to bring in a planning tool, a team like this, knowing that the limiting factor was vaccine availability. And the folks decided that, yeah, it would be better to have us here, work with them, build the plans, have things ready, so that as Lauren alluded to, when the vaccine starts to flow at a higher rate, the systems are in place to deliver that in a timely fashion, and efficiencies are there to get that job done. So that's what we've been doing for the past week, a little over a week. We're making good progress in helping bring some coalitions together of maybe some diverse workforces or non-traditional workforces for a public health crisis, but tapping into those available resources to stand up these sites when the time comes, and really to help with the coordination, again, as Lauren alluded to, with the partners in the community, the healthcare networks that exist in the community that have capacity to deliver vaccine and that are already plugged into the system. So just trying to coordinate all of those efforts, make sure that we're streamlining as best we can the process, and maximizing the availability of the dosages that are out there to get them into the arms of people, which is ultimately that's the tasking that we were given. We are not tasked with doing the actual operations of the work, of actually doing the vaccinating as a team, but truly the planning and support and coordination function, and that's where we've been focused. So we're making progress. We look forward to additional vaccine coming online so that we can implement these resources as the vaccine becomes available, and make that as quick as possible. So with that, I'll hand it back to Stan, and also I'll be around at the end of this to deal with the questions that Stan has. So thank you for your time and for tuning in on this, and stay involved, stay engaged. Information will keep coming out.
Thank you, Randy. Now the next part of the meeting is where we will actually address some of those frequently asked questions that we've collected and have been raised over the course of the last few weeks. So we'll direct those questions to either Lauren Jenks or Dr. Krager. The first several questions, though, that we'll ask will be directed to Lauren. So Lauren, if you could turn your camera on and your mic on, and I will ask you those questions.
Sounds
All right,
good.
Lauren. All right, Lauren. The first question is, how are vaccines allocated across the state? I know you alluded to that earlier in your opening comments.
Yes, thank you. Well, we ask people how many vaccines they think that they can give out, and we certainly take that into account. And we gather information from our local health jurisdictions to find out their priorities for the week about where vaccines should go into the communities. And then we have to balance a number of different things, like the proportion of the eligible population, right? The people who are over 65, the people who are healthcare workers who are eligible for vaccine right now. What's the proportion of that population in the county and in each area of the county? How much vaccine do the providers already have, and have they been able to deliver 95% of that vaccine within 7 days, which is our requirement? And we want to think about getting some vaccine to all different types of vaccine providers, like hospitals, pharmacies, the mass vaccination sites, clinics or federally qualified health centers, local health clinics, right? We want to make sure we're spreading it out to all of those different provider types so that we're getting to all of the people, right? People who might go to different kinds of doctors or places for vaccine. And then we want to make sure that we are getting vaccine to every county and make sure that the providers in the providers in those counties are getting the vaccine to the highest risk populations. So we think about equity in that. We want to make sure that we're getting to people who even people who don't have internet access, or people who may have other barriers in getting to a doctor or a mass vaccination clinic. We want to balance all of that with the ability to get the vaccine out in 95% of it in 7 days, so that we know we're not hanging on to any of it. It's all going into people's arms. And in the end, there are lots of providers who could give out lots of vaccines who don't get anywhere near that amount of vaccine, because we only had a third of the vaccine that people could give out. So those allocation decisions, it gets to be very difficult, and we do that every week as we find out how much vaccine will be coming in. We are hearing at the federal level that we ought to be able to get a projection of how much vaccine we'll have for several weeks, and that will definitely help us, because when we don't know how much is coming in, it's harder for healthcare providers to make appointments, right? You can't make an appointment 2 weeks out if you don't know how much vaccine you're going to have in 2 weeks. And we've had places where that very problem has shown up, where we've had providers who made an appointment for patients to come in and get their vaccine, and then it turned out they didn't get that much vaccine, so they had to cancel and reschedule appointments. And we know that is just frustrating for everybody. And I think it will definitely help if the federal government is able to tell us about how much vaccine we'll have for several weeks out, and then we can solve that problem. But it's all moving fast and changing week by week.
Who determines what providers actually receive the vaccine, and actually how do the providers actually even are they identified?
The people who would provide the vaccine need to be fully enrolled providers within the COVID-19 vaccine program, and they put their requested orders through the immunization information system, and which is the system that we use to track childhood vaccines and all of that stuff. So that's a known system to most of our providers.
Okay, thanks. And if another question, interesting question is if there's less than 50% of the vaccine available in the state have been administered, then why is the vaccine availability an issue?
Yeah, so that number, that 50% number is a tough one because it has to do with, I mean, the denominator there is all of the vaccine that has come into the state. So part of that denominator is the vaccine that showed up today that we haven't given out yet, right? Because we haven't. We just got it. And part of that is the number of vaccines that have been administered and then reported to the state. So there's a little bit of a lag between when the healthcare provider gives you the shot and when that shot gets reported back to the state. So that time lag makes it a difference there. And then some providers are making appointments, right? And depending on how many people they can see a day, that's how many appointments they can make. So they may still have some vaccine that is scheduled for tomorrow or even next week, depending on what their appointment schedule is. We are requiring that all of the providers administer 95% of what they get within 7 days. And then, we take that into account, whether they've met that benchmark into account when we do the next round of allocations. So that percent that has come into the state that has been delivered is a number that can be pretty easily misinterpreted. We definitely do not have a hoard of vaccine anywhere. As it comes in, we're giving it to people, and we're continuing to update those numbers. More vaccine is coming in, more vaccine is getting delivered. It's then getting reported to us, and as all of those things happen, the numbers go up and down. And the other thing I should say in there is that we also need to have vaccine for a second dose, right? For people who, after they get their first dose in about 3 weeks, they need a second dose. And we make those appointments right away. So some of the confusion may be in that as well, that we need to save that vaccine for the people who, once they get their first dose, to make sure we have the second dose on hand.
And one last question for you, Lauren, is how are the vaccines prioritized with respect to the phasing and the tiering? Can you speak to that a little bit? And then how do people determine which phase/tier they're in?
Right, that's a great question. The first thing that we want to do as the vaccine comes in is prevent people who are at the highest risk of dying from dying, right? We want to prevent deaths, and we want to prevent folks from having to go to the hospital, because when the hospital fills up with people who have COVID-19, then we don't have room available for more people with COVID-19 or for people who are having a heart attack or break their leg or, any number of reasons you may need to go to the hospital. So we need to make sure that our hospitals are not full, right? Because emergencies happen and illnesses happen. So in order to make sure that we are preventing death and that we are preventing those hospitalizations, we need to vaccinate the people who are at highest risk of dying or needing hospitalization if they were to get COVID-19. And what we saw right away in this pandemic is that healthcare providers were at high risk. Young healthcare providers without other conditions that would put them at high risk were dying. And it's the theory that I understand on that is because they were getting exposed to so much of the virus at once that they were getting very severely ill. So the first thing that we did was to make our healthcare providers eligible for vaccine. That does two things, right? It protects that vulnerable population, and it protects our healthcare capacity, right? It makes sure that we have healthcare providers healthy and available to run hospitals and clinics and mass vaccination clinics and things like that. The next tier that we opened were people who are over 65. And we know that is a age group where when people over 65 get COVID, they are at a much, much higher risk of needing to be hospitalized or dying from it. And that by prioritizing that age group with vaccine first, we hope to be able to prevent a lot of that. And keep people alive and with us, right? That's really one of our biggest goals here. Next, we start to think about the fabric of society, right? The what do we need? Who do we need vaccinated so that we can keep opening up our society? And we're looking at uh, keeping in mind the risk as well, right? We're looking at essential workers who are over 50 years old, right? And that group comes next. And then as we get into the subsequent tiers in this 1B phase, we start to say, you know what, if you're going to send your employees to a clinic, then send the ones who are over 50 first. And then when we get to one of the following tiers, we'll send the employees who are under 50. If you're going to bring a vaccine clinic to your place of employment, it's okay to vaccinate all of your essential workers at once there and not worry about the age. So we give some flexibility in those tiers. Um, in the case that you're setting to make it easier to administer the vaccine, right? Like if you're setting up a clinic at your work site, then it doesn't make sense to try to do that twice, right? Just do that once and get all of your essential workers vaccinated at that time. Most of the subsequent tiers have not been decided yet what the priority will be. And all of the states are trying to figure this out. I understand California, after their tier right now, is going to go to straight age based. Just start with the oldest and move on, which makes a lot of sense in terms of risk. Other states are thinking about that differently. This is something that we continue to discuss at the highest levels of the department with our local health partners and with the governor to figure out how that's going to roll out next. We do have a little bit of time on that because to get through all of the tiers of phase 1B will take us a little bit. As I mentioned before, we have a lot more people eligible than we get vaccine in the state, right? We're certainly hoping that the amount of vaccine coming into the state will go up and we'll be able to speed that up. But in the meantime, we're taking a minute to be thoughtful about how we continue to prioritize. If you are wondering if you might be in any of the phases that are eligible right now, you can go to Find Your Phase WA, W-A, at .org. And that is our phase finder tool. And it asks you questions about you and your health status. And then we'll tell you if you are eligible at this time. Then print out the page that says that your eligibility page, or take a picture of it or whatever. So you have that. Now you know you're eligible. Right? It is your turn to get the vaccine. And with that knowledge and that printout or picture from Phase Finder, you can then find a healthcare provider who has the vaccine available and make an appointment. That Phase Finder printout isn't enough to go to the mass vaccination site, right? And say, I'm eligible. Yes, a lot of people are eligible, but an appointment is important to get to make sure we have the vaccine for you when you show up. So you would, knowing that you're eligible, you need to find a healthcare provider who has the vaccine, and that changes every week as more vaccine comes in and the allocations change. So even if the doctor that you're accustomed to seeing does not have the vaccine this week, they may have it in the coming weeks, or they may suggest that you call a different provider or try one of the pharmacies or the mass vaccination clinic to make an appointment there for when they have vaccine. Did I cover everything in that question?
I think so. Thank you, Lauren. That was very good, thorough answer. I would just let everybody know that we are actually recording this. So if you weren't able to catch all of Lauren's answer, you'll be able to come back and watch it later. So thanks, Lauren. We're going to now pass it on to Dr. Krager for the next several questions. So Dr. Krager, if you could turn your camera on and unmute yourself, and we'll get going with the next several questions. All right, Dr. Krager, first question for you is, when am I eligible? Where do I go, or how do I sign up to get vaccinated?
Yeah, great questions. So as Lauren talked about, when you're eligible, so if you're in, right now, that's phase 1A and phase 1B1. So if you're a healthcare worker, or you live or work in a long-term care facility, or you're over the age of 65, or you are over the age of 50 and live in a multi-generational household, there are several options. Unfortunately, there's not a single place you can go to get on a waiting list. I want to acknowledge that this is frustrating. It's frustrating for us as we're trying to, give vaccine to people as quickly as possible. And I understand it's frustrating for everyone that wants to get a vaccine. As Lauren mentioned, there's just not enough vaccine to go around right now. We are administering it as fast as we can, but we just don't have enough slots. Hopefully that will change in the future. And I just ask for people to be a little bit patient. But I'm going to go through kind of the different options that we have. The best kind of source for your, depending on the county you live in, is going to your county's public health website. So they're going to keep options for your county up there and accessible. In the future, there will also be more healthcare facilities like pharmacies that will also kind of have places to go to get vaccinated. Another place to go to check is the Washington Department of Health. So doh.wa.gov, checking that website, and then it'll tell you by county who has vaccine available, which providers. So each provider facility kind of has a different process. So you have to kind of check on that website and follow those instructions. We have the fairground site, which is great. Another option for people to get vaccinated. That site does require appointments. Unfortunately, they fill up very quickly. So it was briefly opened yesterday, I believe, for appointments for this week. And those appointments filled up really quickly. So they are running Tuesday through Saturday, and they should open more appointments again next weekend for the following week. So you can access that through the online DOH website or by calling the state COVID call center to get an appointment. In Clark County, we have another process, which is connecting people to healthcare providers that vaccinate. So hospitals, clinics, those sorts of places. If you need help accessing a vaccine and want to get on that website, you can go to Clark County's website and fill out a form, and you'll get put on a wait list. And then we provide, those the highest priority. We provide those lists to healthcare providers in the community, and then they reach out to you. So that is kind of, you fill the form out and then you wait for an appointment, or you wait to be contacted by a healthcare provider, and they'll schedule you up an appointment. Unfortunately, this might take several weeks. We have over 20,000 people who have signed up for that web form, and we're just not getting enough vaccine supplied to our healthcare providers right now to meet the demand. In Cowlitz County, I want to go through this briefly. You can call, if you don't have a healthcare provider that you're connected with, you can call Cowlitz County Health and Human Services, 360-414-5599, extension 6425, and we will post this as well to make sure people have access to it. This is for people who don't have a healthcare provider and want to get on a waiting list. Once there's vaccine available, we will reach out to you and get you connected. You can also email askcowlitzhealth@co.cowlitz.wa.us, and we'll get you on that waiting list. In Skamania County, we ask you just call public health. Their number is 509-427-3861. Skamania is doing vaccines at public health. So when a clinic is available and your turn comes up on the waiting list, we will give you a call and get you an appointment. Clark and Cowlitz County are not administering vaccine at their offices. I just want to acknowledge too, again, that this process is confusing. We want to kind of streamline this as much as possible, but this is what we have right now. All these links are available on county websites as well as numbers. And so we want to make it, as easy as possible, and we'll work towards streamlining this process, but this is what we have right now. Once you get vaccinated, it's important that you get the second dose. Right now, both the vaccines that we have are 2-dose vaccines. It's 3 or 4 weeks later, depending on the vaccine that you get, and you should get the exact same vaccine that you had the first time. So if it's Pfizer, get Pfizer the second time. If it's Moderna, get Moderna the second time. You should have a vaccination card that tells you which one you got. And you should be able to go to the same place and get an appointment for your second dose. Providers are receiving booster doses at the same amount that they got for the first doses from the state. I understand for the fairground site, the Clark County Fairground site, you should automatically get a link that will allow you to schedule that second appointment. So that's kind of the process right now. Again, I want to acknowledge that it's confusing and frustrating. And unfortunately, part of that is, the nature of kind of limited vaccine and us trying to provide as many access points for people as possible. And we'll work towards trying to streamline it. Thanks for having me. I'm happy to answer more questions.
Yeah, Dr. Krager, a couple more questions. What are the counties doing to improve access to the vaccine once the supply increases, especially to those folks in the rural area or that are disproportionately impacted by COVID and adult family homes, et cetera?
Yeah, great question. So once, when vaccines started going out, we realized pretty quickly that, it wasn't happening quickly enough. We knew that our healthcare providers were doing a great job, but it was still a little bit slower than we wanted. So we knew we needed to have more options. So we requested through the state and then eventually through FEMA, this incident management team, so Pacific Northwest Incident Management Team 3, and they're working with us to set up a lot more access points. So what that might look like is among the 3 counties, more kind of stationary, mass vaccination clinics like we have at the fairground site once we have more vaccine to do that sort of thing. I also include kind of mobile vaccine sites or mobile vaccine capabilities. So we know that some people struggle with access to transportation. We know sometimes it's hard to get to a healthcare facility for people to get a vaccine. So for those populations, we want to come to you. So right now, the priority is adult family homes, which are high risk population. They are the 1A in the 1A phase. They're high risk for severe COVID-19, and they've been a little bit left behind. A lot of them have struggled, to make appointments. Some of them weren't able to apply for the federal pharmacy program, which is helping most of our, skilled nursing facilities, nursing homes, and assisted livings, as well as other adult family homes. Some of them weren't able to sign up for that process. So we're going to help them and come out to them and administer vaccine in their homes. There's also a couple assisted living facilities in Clark County that have struggled to get access to vaccine, and we are going to be able to do mobile vaccine for those sites as well. So we want to be flexible. We understand that some people have transportation issues. We want to address those issues and make it easy for people to get vaccine. The other piece that we're working towards, which we're not in this phase right now, but essential workers. So frontline essential workers, these are people that are, grocery store workers, people working in food processing facilities, teachers, those working in schools. These are people that are doing critical functions to our society, but also just as a nature of their jobs, have to interact with people on a daily basis. They can't from home all the time. So we recognize that those people are going to be, at higher risk of exposure. And we want to find ways to bring vaccine to them as well. So what we're imagining and what we're planning to do right now, is to do mobile vaccination clinics for those sites as well. So we might come out to a workplace, we might come out to a school and vaccinate those staff. So that's what we're working towards. We also are working towards, increasing our language capabilities so that people who do not speak English have ways to sign up and access the vaccines as well. That's critically important. So those are kind of the ways we're improving access. Again, right now the issue is supply, but we're kind of building a groundwork so that when we have supply, we will be able to get vaccine efficiently out to people.
Great. And Dr. Kroeger, one more question for you. What precautions should I take after getting the first or second dose?
Yeah, great question. So these vaccines are highly effective. We're very excited about how effective they are. 95% effective when you've completed both doses at preventing COVID-19 disease. We don't know, well, there's a couple things we don't know for sure. One of those is, how protected you are after one dose of vaccine. We think you're going to be partially protected at least a couple weeks after, but we don't know, we don't think it's as good as the 2 doses. So it's important to, maintain the precautions that we've been talking about: masking, physical distancing, washing hands, avoiding crowds. Those are still vitally important after you get your first shot, as well as after you get your second shot. The reason we are being a little bit extra cautious, even from people who've been vaccinated with both doses, is we don't know for sure that the vaccine prevents asymptomatic infection. So we know that the COVID-19 can spread through people who don't have symptoms. There's a chance that the vaccine might not prevent that sort of thing from happening. So you could be fully vaccinated and still potentially have a small amount of COVID-19 in your system and potentially infect another person. This is, possible with other vaccines. The rotavirus vaccine is one of them. Great at preventing, really severe rotavirus disease, and good at preventing most cases of rotavirus. But some people can still get a very mild rotavirus infection even after vaccination. We don't know what's going to happen with COVID-19, the COVID-19 vaccines. I'm very hopeful that they're going to prevent all types of infection, and that we'll, be able to return to kind of a sense of normalcy where we can have parties, where we can go to concerts, we can go to restaurants, all these things that everyone wants to get back to doing. I'm hopeful that we're going to get there, but right now we're still in a very high COVID-19 activity level. Not very many people have been vaccinated right now. So we're asking people to continue those precautions until we have more data and until more people are vaccinated.
Thanks, Dr. Kroeger. We'll address a couple more questions direct a couple more questions to Lauren before we go to the Facebook questions that are coming in. So Lauren, if you could turn your camera back on and unmute yourself. All right, thanks. So this next question is, how long will we have to wait to receive a vaccination?
Is this about the phasing? You mean like when is it my turn sort of a question?
Yeah, and how long will that be?
Right. I don't really know because it's going to depend on how much vaccine is coming into the state. And there's a number of issues with that, right? It has to do with how quickly the manufacturers can manufacture it. And it has to do with new advancements, right? Like we're hearing exciting things in the news about the Johnson & Johnson vaccine. Maybe that will be approved for emergency use, and we'll have a third vaccine that's available and can be distributed. That would mean a lot. We have a lot more vaccine, and that would speed up when it becomes everybody's turn. I am not an essential worker. I get to work here in my house. I don't have to get exposed to the general public. I'm not over 65. I don't have any any other conditions that would make me eligible earlier. So I'm kind of thinking about maybe I get mine in June or July, right? I don't know that, but that's the kind of time scale that I'm thinking about. My husband is a high school teacher. He is now over 50, so he's not in the next tier, but it may be that he gets his, in March or April, right? Like it just kind of depends on your particular situation, how your employer works, how your which because some of it's the luck of the draw, right? Like if you call a provider who has a vaccine available, that's you maybe can get an appointment quicker, and it depends on how much vaccine comes in. But certainly, I'm hopeful that by the end of the summer or fall, we've got vaccine for everybody, and we're able to. We're no longer telling people to be patient, but we're rounding up folks and bringing them in to get vaccinated.
Yeah, Lauren, appreciate your providing that context for us. It's quite an effort to get everyone vaccinated, so appreciate that. One more question for you, Lauren, is do I have to be a resident of the county or state to receive a vaccination at one of the sites?
Yeah, you do not need to be a resident of the county for sure. We're trying to put these mass vaccination clinics spread out in the state in places where people may not otherwise have access, right? We're trying to get it to spread out in like in Wenatchee and Kennewick and places that are a little bit more rural, so that people who just don't have the density of healthcare providers, like a place like Seattle, might also have more equitable access to vaccine. So we're hoping that's convenient, right? And people will go to the place that's closest to them and convenient for them. We're not expecting like you open something in Kennewick and people come from all over the place. So we're still in the pandemic. We're still hoping that people are staying close to home and staying inside as much as possible. So this isn't a time that we're hoping people will travel across the state, right? We're hoping you will go to a place that is close by you. That being said,
She froze. Uh-oh. We lose her.
Yeah.
All right, I think we lost Lauren.
for convenience sake,
There she is.
I'm getting a internet is unstable message here.
We lost you for a little bit, but you're back now.
Okay, sorry about that. What I was trying to say was that it does not matter what county you live in. Like, try to go to a place that's convenient for you, whether it's close to where you work or where you go to school or live. That's fine. It doesn't matter what county you live in. The vaccine is given out state by state based on population in that state and other things. So we don't want people crossing the state line to get the vaccine, because that first of all, different states have different ways of prioritizing groups, and none of us have enough vaccine right now, and we're really just trying to focus on each state using their own strategy and resources to get folks in their state vaccinated.
Thanks, Lauren. I think we do have a few moments to address some of the questions that have been coming through on Facebook. Unfortunately, we don't have enough time to answer every single one of those questions. So we'll address a couple of those questions while we have some time this morning. And just to let you know, the county folks will be trying to answer those questions as they can throughout the rest of the week. So Lauren, if you're still on, I think we'll ask you a couple of questions here that came through on Facebook. The first one is there a plan to better support the scheduling system? The concern is that every time a new appointment window opens, the site crashes and people lose out on the opportunity to sign up.
That is super frustrating. We knew that that crashed the first time. I did not know that that was still happening. What we have been trying to figure out is whether you could go to one place and sign up for a vaccine depending on where it is available and what is close to you. And I'm thinking about like Expedia or something. And now I try to make an appointment.
We keep losing her.
I think we lost Lauren again, having some internet.
We are thinking about how to make that whole process easier for folks, but that's what we've got in the works right now. Trying to figure out that appointment aggregation system.
Yeah, Lauren, you cut out again a little bit while you were answering the question. So, but I think we got the gist of it.
Yeah, okay.
All right. Another question for you, Lauren. What is being done to verify that individuals at the Ridgefield site are Washington residents? You sort of answered that question in this previous one, but maybe specifically, how are folks being verified they're Washington state residences?
At that particular site, they may be checking IDs. I did hear at some point that was happening. We haven't required that. We're really we're communicating to people in Oregon that, you have your own sites, and these sites we're opening up for Washington residents. And make appointments when they're eligible in the state where they live or work.
All right, thanks, Lauren. Again, you cut out just a little bit again, but I think we got the gist of it, that they might be checking for state residencies at Ridgefield. All right, so Dr. Krager, a couple questions for you through Facebook. If you could unmute yourself and turn your camera on, and Lauren, if you could turn your camera off, that'd be great. All right. I'm sorry, I had the question up here, but how do we find out which vaccine is being administered? Do they give us an option of which one we can get? I don't prefer, or I don't want the Pfizer vaccine, but I want the Moderna.
Okay, yeah, good question. Wherever you're getting your vaccine, when you make the appointment, for example, through the Clark Fairgrounds site, it tells you which vaccine they're giving, which right now is the Pfizer vaccine. If it's through a healthcare provider, you'll just have to ask which one they have. Some healthcare providers have both, so you'll want to confirm with them which one you want and which one they're giving. So that's the way to do it. And then once you get vaccinated, you will get a vaccine card that also describes which vaccine it is and the lot number and all those sort of things.
Okay, great. Is there a certain day of the week that the vaccine is released, or should we continue just to check every hour of the day to register?
Well, unfortunately, it depends on the site that you're talking about. So the Clark County web form, directly through our website, you can sign up anytime, and then you'll just wait until a healthcare provider reaches out to you. The Clark County Fairgrounds site, they've been opening their registration over the weekends, and they fill up rather quickly. Vaccine comes throughout the week, really. So providers find out late Friday how much they're going to get for the following week. It makes planning a little bit difficult sometimes, which is part of the struggle making appointments. Providers can't make appointments if they don't know for sure that they're getting vaccines. So that's part of the struggle as well. So they get a notification about how much they're going to receive Friday for the following week. And then when it comes actually kind of varies on shipping times. Some providers get it Monday, some providers get it a little bit later in the week. So that's kind of how that process works.
Right. A couple of questions regarding some of the large healthcare providers. One is a question about Kaiser Permanente, whether they're following the Oregon or Washington tier at the Washington clinics.
So my understanding is that they're supposed to be following whatever state they're operating in. So they should be following Washington's tier guidance in Washington state. If they're not, we'll kind of have a conversation with them about that, but I'm not aware of that happening right now.
Okay. And another question about Peace Health in Longview. And I think maybe this has been answered, but I'll ask the question anyway. Could Peace Health in Longview be authorized to give vaccines to anyone in the eligible category or just their patients?
So I think that's a decision or a question for Peace Health. I know in the past that they have vaccinated people outside of their own patient kind of group. I have heard recently that, with their vaccine, limited supply, that they are only vaccinating people that are, currently associated with Peace Health. So it's a question for them. I'm not sure what they're going to do going forward. We'll have those conversations. I mean, from public health's perspective, we want the vaccine to be available to anyone that fits the criteria for it. So that's what we're working towards.
Thank you. Finally, where can Clark County residences, or for that matter, Cowlitz and Skamania County residences, sign up to help at vaccination sites, the volunteer opportunities?
Yeah, great question. So for Clark and Cowlitz, there's a kind of public health emergency preparedness page on Clark County Public Health's website that has a link to sign up to be a part of our Medical Reserve Corps, which is people we are tapping to help out in these sorts of situations. So that's on Clark County's site. Skamania, I'll have to check and double. You can call Skamania and check. I'm not aware of a link on their website at this time, but yeah, for Clark and Cowlitz, you can sign up there. You also don't have to be like a healthcare provider. We do need people that have other skills or just want to help in another way. For example, managing traffic or signing people in. We don't need people that we need people who can give the vaccine, but we also could use people that might have time in other ways. So through Clark County's public health emergency preparedness page, there's a link that you can sign up there.
Thanks, Dr. Krager. And maybe we'll do one more question. Hopefully Lauren's connectivity is good. And this one is for you, Lauren, if you could turn your camera on and unmute yourself. The question is, why isn't there a standard statewide appointment system, especially for the state-sponsored mass vaccination sites?
There is, and we call it Prep Mod, but not every one of the mass vaccination sites chose to use it. So we do have that, and we are certainly hoping to improve it so that we can, like I tried to mention before, if my connectivity was there, use it sort of like an Expedia thing where it knows all of the doctors and all of the vaccine that's available and everybody who has appointments. So you can so we're hoping to expand that system so that it works a little better for everybody.
Right. Thank you, Lauren. Okay, well, we're pushing 12 o'clock. We're actually at 12 o'clock. We really appreciate you guys taking time out of your day to listen in. And also thanks to Lauren Jenks and Dr. Krager for taking the time to answer some of these sometimes difficult questions. So we appreciate that. Also, just want to let you know again that this Facebook Live event is being recorded and will be reposted back onto the county websites for future viewing. And then again, as I mentioned earlier, I use that in quotes, the county folks will be answering as many of those questions that you've been posting on Facebook as quickly as reasonably possible. It may take a little bit for them to do that. So appreciate again you guys being here, taking the time out of your day. Remember to continue to monitor your county's Facebook site or website and the state Facebook and website for up-to-date information. So thanks again for joining us. This concludes our meeting and have a great day.